Hello.
Hi, I'm Ann Loring. I'm the nurse manager of the education department at CHI St. Vincent and also the manager of the RN residency program.
And my name is Sarah Beeler. I also work in the clinical education department and I manage the students that come here for clinical rotations as well as coordinate the patient care tech program.
What we'd like to do is show you a demonstration of a bedside shift report for a PCT to PCT handoff. And following that, we'd like to talk to you a little bit about doing a situational awareness survey of the patient bedside prior to leaving the room to make sure the patient has everything they need and all things are in place and the patient's safe. Okay?
So to begin,
Patient.
we always want to knock and obtain permission to enter the patient's room and sanitize your hands as well. There are gloves located at the entrance. Hello, Mr. Smith.
Hi, Mr. Smith.
This is me, Sarah, your nurse, or your PCT, excuse me. And it's the end of my shift, and Ann is taking over for me.
Good morning.
All right, we're gonna check your armband. You tell us your name and your birthday.
And he has verified that his name is Mr. Smith, and he was born June 2nd of 1948, and you would like the patient to state that whenever possible for themselves.
Absolutely. Okay, so Mr. Smith, I'm going to update Ann on your condition and explain what's going on. If you have something you would like to add, please feel free to do so. So Mr. Smith is here in the hospital because he has pneumonia. And so he also has some dementia, so he is a high fall risk. So we're keeping a close eye on him and implementing some fall interventions to prevent him from falling. He is on a regular diet, so he's able to eat or drink whatever he pleases. He also is a one-person assist. So I'm able to get up and walk with him to the restroom, but he's a little unsteady. So I wouldn't let him walk by himself. I would assist him
Okay.
so that he doesn't fall. He does have some weakness. He is continent of bowel and bladder. And he is pretty good about pushing the call light to let you know whenever he needs to use the restroom. Is there anything else that you need to add, Mr. Smith?
I noticed he had some allergy bands too on his arm.
Yeah, let's take a look at his allergies. So Mr. Smith has a latex allergy, so we need to avoid the use of latex for him. And then we'll say he also has an allergy to aspirin. So he has a couple of allergies that we need to be aware of.
Thank you. Is it okay if we take a minute to look at all of his tubes and make sure that they're in a safe place?
Yes, I
And
think
take a
that's
look around the bedside?
I think that's great. So we're gonna assess the environment because while we're in the patient's room, we can go ahead and address any concerns that Mr. Smith has or any safety concerns with his environment. So, Ann, what's something that you're noticing?
I have a little concern that his oxygen is not properly placed on his nose.
Yes, did you pull that down, Mr. Smith? Let's place that back in your nostrils. Very good.
And do you know, if I could ask you, is the nurse aware of the bleeding on his dressing?
Yes, he did have a fall 2 days ago.
Okay.
And so he obtained this injury from the fall.
Okay.
And she knows about that.
Is there any reason why he can't sit up a little higher in the bed, or does he prefer to lay flat?
I think we can sit him up, sure. Yeah, it's always a great idea to sit the patients up to promote their lung capacity.
There you go, Mr. Smith.
Oh, and look, his call light is on the ground. How's that it up there?
I don't know, but I'm glad you found it.
Yeah, so I'll put this close to you, that way you're able to push it. If you need anything, if you need assistance to the restroom, if you need anything at all, please push that button.
Let's take a look around his bed sheets and make sure that they're positioned and not wadded up underneath them. and he's comfortable. We'll keep you well covered, Mr. Smith, as we just take a look at your tubes. And I notice his catheter has kind of a loop in it. Could we extend it down the foot of the bed so it's draining right?
Oh, yeah, sure, absolutely.
Oh, and his sock looks like it's coming off. There we go.
So these are socks that are non-skid to help prevent him from falling.
Oh,
they
right, the yellow
applied-
socks.
Yes,
Got
very good. They need to be applied properly.
Okay, so should I also make sure I get a yellow band for him then later this morning, or as soon as I can this morning?
Yes, if you would, and that would be very helpful.
I'll
Thank
do
you.
that. I'll make sure I do that. This side looks okay.
Okay.
So the bed seems kind of high to me. Does it seem kind of high to you?
Yes, I think we could go ahead and lower the bed
Down to the ground.
to help prevent injury if Mr. Smith were trying to get out of the bed.
Do we have set breaks? It feels like we do.
Yes.
Okay.
Do you want to come look at the Foley catheter over here?
I do.
So, it looks like it's gotten tangled in the side rail, which could be dangerous for the patient.
I'll make sure I hang it down low and the tubing is straight and secured on the sheets with this clip
Very nice.
to keep it straight.
Good.
That
Now that
looks
you're
like
able to
it's
flow
dumping.
freely, and I emptied it about 30 minutes ago.
Okay, great. Let's take a look and see if maybe we can make him a little bit comfortable. Has he been laying on his back for a long time?
Yes, Mr. Smith has been on his back for this afternoon.
Okay, Mr. Smith, before we leave your bedside, we want to make sure that you're comfortable and you have everything that you need. Since you have a catheter, we know that you're able to empty your bladder, so you shouldn't have to pee right now. But we want to turn you on your side to get you off your tailbone for a little bit. So I think we have another pillow right around the corner. Let me just grab that.
Okay, we'll turn you and make you comfortable.
Okay, Mr. Smith, if you want to just prop the pillow.
Sure, on the count of 30.
We'll tip him and make sure he doesn't have any sore spots back there or any extra wrinkles in his blankets.
So I'm looking at his bottom, his backside. I don't see any redness, and I'm going to prop this pillow
Okay?
against his back. There, that gives your backside a little bit of a rest.
Perfect. And we'll make sure his heels are up off the mattress too.
Great, go.
Mr. Smith, let's get everything close to your bedside that you know you like to have. Is there any reason that he should not have water?
He is on a regular diet, so if he would like some water.
This doesn't go any higher.
No.
Okay, he's got water here. I notice he's got some thicket packets here.
Maybe we should check the order in the computer
Okay,
and see if he's on
Okay.
a regular diet or if he's on thick liquids.
okay,
Because we definitely need to follow the proper order.
okay, we'll check the order. And then he's got his belongings box here. It looks like there's some items in there like syringes.
So this personal belongings box is just for the patient's belongings. It's not for the staff belongings. So if you notice nursing supplies, please remove those and let the nurse know. This is for Mr. Smith if he had hearing aids, a cell phone, denture, some type of small belongings that we didn't want him to lose.
So maybe I'll get him a new one and we'll get the nurse to perhaps discard anything in this box in a sharps container before we throw it out.
I think that's a great idea.
Okay. So we've got his something to drink here. We'll verify that he can have regular water as opposed to thickened liquids.
Yes.
We're gonna get rid of this box. This looks like an extra battery from someplace.
Yeah.
We'll turn it in.
Okay.
And he's got his menu nearby. Have we forgotten anything? His phone.
Oh, yeah, Mr. Smith's wife has been calling him every morning, so he'll want that phone closed for that phone call.
There you go. Mr. Smith, the last thing I want to know is, are you comfortable now or do you have any pain? And so if he had pain, I would want to let my nurse know that right away so that she could address that.
Absolutely.
Right now, everything looks exactly how we would like it to be. to start the day.
Yeah, I think he looks great. If you need something else, please push your call button and let Ann know. And thank you for letting me take care of you.
Thank you, Mr. Smith, for letting us take care of you. And before I leave, if there's anything else at all, I'm happy to get that now. If not, so I will be back within the hour, or my nurse will be here within the hour to check on you again. Okay, thank you so much.
Great.